this. But if I were doing a side bend technique to the head like this, and this is wrong in the book that you'll see on page, I don't quite know how I managed to get that picture there. Which is probably the one on page 10, okay? If you do what I'm doing there, you have to make sure that the chin is rotating. You mustn't stop it rotating. And one of the problems if you put your hand around the chin like this is you stop rotation. So the mobilizing to go to left side flexion mobilizing would be to simply put the hand like this and allow the chin to rotate as it wishes to as I'm mobilizing. Now then, if I've got my hand around the chin, I've got to actually induce a rotation at the same time in the correct direction, which of course for side flexion to the left is going to be rotation to the right. So my hand there has got to be producing a rotational motion. So if I were trying to manipulate in that position, I would be round and I would have to try and do both those two moves. It would be that movement. So the picture on page 10, make sure that you absolutely know that the chin must be allowed to rotate. It must not be held fixed from rotating. And if you put your hand around the chin, you've got to induce some rotation with the hand. Otherwise it'll stop rotation occurring. And so that's quite important.
Allow it to left rotate?
Yeah, allow it to left rotate, or produce left rotation in that particular case, and allow it to right rotate or to produce right rotation.
If you were doing it, but for this particular drawing.
What's the thing here? It's a right side flexion, so we'd be producing right side flexion, we'd be allowing left rotation to occur, or we'd be producing left rotation. Now, with the hand round the chin, you've got to produce left rotation. If you just leave the chin free, like I'm doing here, then whatever rotation wants to occur will occur. Yes?
It seemed with the mobilization that you were
Down.
pushing more with your forearms.
Mm-hmm.
With manipulation you're pushing more with your arch of the atlas hand.
Mm-hmm.
Is that correct? So you change?
Probably not so much that's happening. This is giving a little impulse just to stop it moving, because then if that was happening and this was pushing across, I'd have to be accepting that there's a translation of atlas on axis. Yeah? Nearly caught me there. Dan, nearly caught me there. So what, and I'll just show you, if we went into a sitting position for this, let's show this as a manipulation for this area, and we'll practice this. Okay. You'll have to turn around. I don't think I can do it with my thumb. So let me do the opposite side here, just for the time being. Let me see how I go here. Okay. When we talk about the rotation and the side bend manipulation, one of the techniques that is done quite frequently, and it's not a bad technique actually, is to bring the neck round into rotation like this and then hold on to the atlas. Now I'm going to try and get hold of the atlas, and I'm going to take my hand down onto the occiput in that fashion. Now, what I'm going to do is to do a little rotation and side bend. Now, where my body is standing over this patient, and this is a British osteopathic technique, you'll find that the side bend will go like this and the rotation will go like that, just simply because of where I am, like that. You can see that the correct movement's occurring. So I hang on to the atlas as best I can, all right, getting right round, take up the slack to that position there, and the movement would be just like that. That would be the manipulation. Now, the question is, with Chris, that's about his maximum rotation. If I were to put Anne just in the position and not actually do it, she would probably get much more of a rotation coming around there. You can see I'm coming around into this position. And that's where you normally see it done. Now, the question is, the rotation that exists at the occiput on the atlas takes place at the limit of the atlantoaxial joint motion. But if we fix the atlantoaxial to stop it moving at all, could we actually do the technique in that position, which would mean that all of this rotation, which is the thing that we worry about at the atlantoaxial joint, is still present, and it would sort of absorb some of that rotation if we failed to hold this absolutely solid. But it would only be in a very small position like that, okay? And she's still got all this rotation all the way around. So I think that we should be doing, if we do this technique in side bend rotation like this and a little movement like that, we should be doing it in the neutral position rather than in what you normally see, which is way over to the side like this, coming around here and doing it like that. This is very nice and easy to produce clicks in this position, but it has got that problem of creating a full rotation, which we're trying to avoid. However, it is producing a full rotation in slight flexion, not in extension, which we've tried to avoid once again. So over the years, this particular technique has been done really quite well, and it's stood a lot of people a lot of good stead in this position. And you can actually even do it with a little traction like that too, in that position. So for us, we need to stabilize. We're going to try and do it in the neutral position there. It means we've got to take it into the barrier, then we'll probably increase the barrier or engage the barrier, which is the term, by doing a little derotation below, and then I'm just going to give a little twist like that, and because my body's over, you can see that it produces a side bend to the correct side in the presence of rotation to the opposite side, which is the coupled movement. So that would be the manipulation that we should do in this particular position. Now, before we do that though, I'd like to just have a look at a distractive technique, if we could, on the AA joint. So we should do some manipulation this morning, and then we'll have lunch. So I'll get Chris to come out here, please. And if you could come around. Yes, please. Okay, Christine.
It's on the floor.
Is it on the floor? Or is this, no, this is a hand one. Okay. Just lay on your back then, please.
It's around, it's around.
Okay. When we were discussing the vertebral artery test, we've done all of the tests. The only thing that we haven't done is to say what is the peculiar set of circumstances to the vertebral artery of this particular manipulating position. So I could hold Chris, and Maine suggests that we do this, that whatever technique we're going to use, we always hold that position for a few seconds to see whether in fact that produces any symptomatology. And I think that's a reasonable thing. The only thing that we're not checking is, in that position when I do a sudden movement, how does the vertebral artery? We just can't do that. You could put a little bit of tension on it if you like, going up to where you think the barrier is. But I mean, the barrier is being engaged and then moved, and it's a very small amount of movement in actual fact, and the speed means that it's on and off and it's finished. And I think very often in some of the medical problems that have occurred is that many times people that don't manipulate very much or very well do high velocity movements, and they kind of hold them there instead of, and they're finished. And I think that quickness and the speed and the small amplitude is probably part of the safety as well. Instead of high velocity, high amplitude movements, they are nothing to do with anything that we would even recognize as being acceptable nowadays. So with Chris here, it's going to be exactly the same technique that I used previously. I'm going to engage now the atlas. So I've got to feel the mastoid, then I've got to come down onto the transverse process of the atlas, and I'm going to go just behind that and try and get just a little underneath it, so I'm not putting a tremendous amount of strain on the transverse process. Otherwise it's very uncomfortable. And then I will be side bending and rotating simultaneously because I want the axis to stay in its middle position. And as we know, if we do that simultaneously, the axis will. If we just side bend, axis will move because something's got to give the lengthening of the alar ligaments. So we will just side bend and rotate simultaneously, and only sufficient to give us a lever so I don't slip off. And as you can see, when I do my impulse on this side, the basic tendency for the impulse will be on this side. And if I don't hold this hand fully and I let it go a little bit, even so, the basic technique would be it would straighten the neck with the impulse from this side. It's not going to increase any of the angles. On the whole, it reduces the angles as I go into my technique. And that's one good thing about this. We're going back to neutral. We're trying to keep things in the neutral position. So this would be the same as we did yesterday, except instead of coming on the mastoid, I'm coming on the atlas now. And I should just be around there and just do a little position like that. Where is she? Where's Barb? Very good. I managed to do it with this hand. That's very good. That's excellent. And so that would be the technique, and it's very small amount of motion there. And you can see that in freeing this, the desirability of this is a lot less stressful than doing some of these mobilizing techniques in this position.
Force again, distraction?
Yes, a distraction force. I came up under here, and this gives me most of the impulse. So it would be to free this one on this side. This is atlas axis, yeah. Exactly the same technique. So what you can see is the ubiquitous use of distraction. It's so good for all the way down the spine, doing a very safe movement. And this is very safe in this particular position.
Could you do one more time, please? One more time.
Yeah. I have to come on to the other side. All right. So I palpate the atlas, get the back of the atlas here. Take hold of the head because I want to just leave it on the pillow though, which we haven't got, but let's say we have got a pillow, and I just want to get control. I'm round into that angle position there, slight side bend rotation simultaneously there, and I'll be in that position. It'll be just to do that movement there. And that would be as much force, and that was, even in Chris, that released quite nicely.
Did you have your hand around his chin, or did you let that again?
No, I would put it round like this, in that position.
Allow the movement.
Yeah, so I can allow the movement to come there. And when I push there, this goes at the same time. So that would be what I would do. That would happen. But even if I didn't pull so much with this, and that happened, it would straighten slightly, which is kind of good. What I must try and avoid doing, of course, is hauling like that. That would be very bad. Like this. You know, with this hand doing it. This hand is like a passive hand. It's merely acting in concert with this, which is the thrusting hand. That's where it's all got to take place from. Shall we do it? Let's get at it. Okay.
You know that gaseous pop that you talk about? Like,
So good. When he leaps on his desk and he says, boys, I want you to look at the world in a different way, you know, and they all get up there and look around and everything looks different from up here, okay? One of the things that is kind of interesting, sometimes we get stuck along, and the other bit in that movie that I really liked, and it's kind of interesting, in the men's group that I go to, they were going to go drumming, okay? And they're all asking me, and I've been really upset about the drumming business. And largely this is because in that movie, you know, when everybody's moving around like this and he starts to slowly clap, and within no time at all everybody's walking with the same cadence, everybody's doing the same thing. And you know, this is how you're subjected to various stresses where they get us to conform. So I think if I go in this drumming business, am I going to be conforming with this? So I kind of put it off. I got home too late from work, and I came to the conclusion when I went to the group next time that I'd actually made sure that I got home too late to actually get my car out and to go, so I'd have a reasonable excuse. And they all had a great time. And they were all in there saying, geez, I'm so sore. This was a week later, because all this drumming, they drummed for like an hour and a half without stopping. So it's really quite interesting. But it's this business where this drumming or this business, okay, nobody wants to create clones of yourself. That's why I think we've got to have a system which allows new ideas to come in. And, you know, perhaps I'll see you again sometime and you say, geez, well, I went on this course and I really learned something good. And I don't say to you, what the hell were you doing going on that course? Why would you do such a thing? You know, that's so wrong. You say, Carl, let's get down there and show me what you're doing. And that's what's so important about our attitudes of taking in new stuff. So we've kind of got this thing, all right, and we're doing this, and we sort of think to ourselves, geez, this angle's a bit bothersome. I'm really troubled by this angle, and I don't seem to be able to get it properly. So you look at Evian, who's got a different way of doing this, and you think to yourself, why didn't I think of that? Come here a second. Lay on your back for a sec.
On my back.
On your back, yeah. And this is a technique that I think we should all be kind of looking for as a little difference here. That I'm looking at this and I'm sort of getting my arms stuck, or perhaps if Chris was Arnold Schwarzenegger or something with this huge pectoral development or something, or it could be, you know, a woman that's got a large breast development. I don't want to sort of push myself down on her here, because this is what I think might get me into a problem. Lay on your side, please, and put your hand over the end of the bed, if you would. Right up here. Just let your arm dangle down. You keep coming, and just dangle your arm down there. So I could actually come into a position where I side bend, rotate, and get into this position, where I'm now, I can let him roll his shoulder forward, and I'm now in a very good position to get from the back and just do my little movement like that in the side bent position. You know, so there are these changes that we should be looking at of, can we change the positions a little bit? Now, once you've got used to doing it in one position, it's like everything else. It's a little bit difficult to change. So I wanted to sort of introduce some of these to you, and perhaps in the next couple of days we can try one or two of these things. You see, another thing is that when we now take your minds off the 1, 2, 2, OA 1, 2, and let's go down to the 3, 4. And when we go into a side bend rotation opposite position, the vertebral arch that we're trying to engage sort of goes forward, and it gets a little bit inaccessible sometimes. So that when I'm looking here, it's right there in the muscle. Now, what would be the case if I side bend him this way, rotated him that way, so it's come back into my hand now, and I can do that. So it's much more prominent under my fingers to do the distractive technique. Instead of, in this way, it's kind of disappearing forward. I can bring it backwards by coming here and there and doing that movement. So this side-lying position might be where we should be sort of trying to develop a few new techniques in this particular position. Thanks, Chris. Now, what we'll just do to finish with, just lay down, for our hard-working patients here, I'd like to do just a little bit of distraction in this area. I'd like to do just a little bit of coming into a flexion mobilization with eye movements. Can you look down towards your chest and just have a little bit of a motion here? And then, to finish everything off, we'll do the translatoric movement of massage at the C1-2 joint, which you'll see is in the book here, and I'm putting my fingers right the way around the axis, which means if I move the axis this way, I'm rotating that way, which means I need to have it into side bend this way. So I'll just lay my hand on the outside of Chris's head here and just move around in this translatoric way, moving the axis round here, massaging over the suboccipital muscles and making sure that I keep the same movement going, the correct coupled movement going for the craniovertebral area. And then we should all be able to go to lunch and enjoy it because we're not feeling sick and dizzy and everything by all this. Okay? So let's have a little go at this just before we leave. Distraction, some techniques to relax the craniovertebral muscles, posterior, translatoric massage in slight neutrality. So let's have the ends off now. Your necks have recovered. I'd just like to do one other thing and then we'll sort of start on the lumbar spine. With, if I could use you, Chris, we'll put your head at this end, I think. Yes, please. Yes, please, put your head at this end. In the past, same thing. In the past, sort of techniques have been done of rotation of the AA joint, and one wonders really whether this is advisable at all, particularly in the view of the fact that the distractive manipulations are so useful. They're safe. They're not all that easy to do. On the other hand, watching you people coming around here, all of you have got a really quite brisk manipulative skill. That's very good. And it's very gratifying. And so I think that we've got a very, very useful thing to do as far as the AA is concerned. However, sometimes distraction doesn't work, and you kind of think, I wonder if I could sort of restore rotation. Well, just let's talk about this for a minute. When we look at rotation, one of the things that we've spoken about is that it's very important for us to try and ascertain whether we're dealing with a backward gliding facet or a forward gliding facet. And we can do it by examination of just feeling the forward gliding nature of the movement, or we can look at it at the backward gliding nature of the movement. We can analyze that also in relationship to forward bend and backward bend, so we can have some idea of which of those joints are concerned. Now, I have no basis for saying this, that's why I'll say it with such conviction, that the backward gliding problem is by far and away the worst in terms of the restoration of this and the consequences of having a stiff backward gliding joint, because it tends to give the forward gliding joint hypermobility, and we know the consequences of that in terms of the transverse ligament, as you came out with yesterday, and also the vertebral artery. So I feel that if we've got a backward gliding joint, that the only manipulation we should ever think about is doing a distraction, and probably that's only if we cannot get the movement by doing mobilization with that body backward movement. That's how I would do it, of holding the axis, using my body and taking back that backward gliding joint into a little bit of extension with the rotation, because we're coming back into a bone-bone position, and I'm manipulating into a bone-bone position, as we're going to find out this afternoon when we try some of these lumbar techniques, is not necessarily a very easy or desirable thing to do. So, as a rule, if we've got stiffness in the backward gliding joint, mobilization is the way to go, I would feel, using that technique that we've discussed. Secondly, if mobilization isn't working so well and you plan on a manipulation, the manipulation should essentially be a distractive manipulation, period. I don't think we should be doing rotary manipulations if we've got the backward gliding one that will not go backwards. However, if we've got stiffness of the forward gliding one, which will come as a contralateral pain and contralateral restriction of a particular rotational movement, and it should go, shouldn't it, with a flexion restriction, then distraction is going to be our primary manipulative thing. Once again, probably mobilization would be with augmentation through eye movements and augmentation with breathing, and post-isometric relaxation would be the best way to start this. However, we've been doing that and nothing very much has been happening. So then we decide we'll do a manipulation. The primary manipulation ever in the AA joint should be the distractive manipulation. All right. Now let us just talk for a moment about the possibility of doing a rotary manipulation. Now, when we do a rotary manipulation, it's obviously important for us to take it to the barrier engage the barrier and be particularly observant when we hold it in Maine's vertebral artery position test that there is no problem. That would be even more important in this particular case because we're actually doing rotation. The next thing that we should consider is how can we make sure with such a big movement that we limit the rotation to just 1 or 2 degrees of rotation. That's the big problem. And when you look very often at some of the books, you'll see people over the end of the table and people taking them right round into a rotary movement. And we know that rotation, particularly with extension, is the movement that has caused the major problems. In like 65% of the cases on that board were vertebral artery problems. So we need to be very careful. So how was this limited? Well, as far as Stoddard was concerned, he used to have the patient into a position like this, and he would hold the axis with his fingers. I'm going to have to get another towel. Just excuse me for a second. Perhaps actually, this is not quite wide enough, this end piece. No, stay there, Chris. Just not quite wide enough. Okay, so we've got a pillow here. And what Stoddard used to do was to hold onto the axis like this, take the neck round into the end range there, all right, so that he would have sort of engaged the barrier. And then he would use a sandbag or a block there so that when he pulled round there like that, this would stop any excessive motion. But this doesn't seem to be, if you use a big sandbag, it's not bad. He used to tend to actually use towels rather than sandbags. We modified it, I must say, to put a sandbag in place so that as you flicked around, you were holding onto the axis, then you stopped on the pillow here, and that just took you through that barrier. And of course, all of us have used this technique for many years without any great problems, not even knowing anything about forward gliding and backward gliding. I mean, we just had no concept of that at all. But probably a better technique to do is the one that involves the side flexion, particularly if we can do a very good side flexion of the rest of the neck. Now, I'm not sure how good this is going to be with Chris because he's a bit restricted in his neck movements anyway. So let's take somebody that would be moderately difficult and just see if it would work at all. It's ideal if you can get the head right round onto the shoulder like that, which means that what I'm investigating now would be the last 2 or 3 degrees of cervical motion like that. And if I'm at the barrier now, by giving a little flick in this position, I will actually engage the barrier with the flicking movement and go into the barrier. So provided this is on the stiffness on the left-hand side to bring it forward, I think the rotary techniques are perfectly okay. But they're not okay, just to reiterate, if it's on the backward gliding one, as we've written down in your notes. So I would get into this position here, just take Chris up into the barrier, which would be there, and this is very similar to that little flick technique that we did yesterday when